Hi there, my name is Dr. Washira Murage of Savannah Healthcare, and today I want to prompt you about a common condition that many people do not understand after a lady has delivered, and this is postpartum psychosis. Postpartum psychosis is a condition that is normally affects mothers after they have delivered, and many a times we tend to ignore it, and I probably would want to speak also to the husbands and the men to try and assist our mothers whenever they have some queer behavior. Let us not say that ni madharau, let us not say that wamenyeta, and let us seek, because it could be a psychosis, it could be postpartum psychosis. And how does it come? Postpartum psychosis sometimes starts during antenatal period when the mother is pregnant. This is where the support of the mother comes in. When mothers are coming to the clinic, the husbands and the relatives and the society at large, how they support the pregnant mothers. In the public transport, how do we treat them? When you come to restaurant, do we give them preference? Do we support them? Do we tell them that they look good when they are pregnant? Or do we just say maybe they are deformed or they look otherwise, because it is important for them to feel that they still belong, especially in the family setup. How do we as husbands treat our pregnant mothers? Because if they feel unwanted, they feel that they do not look good, they feel like they're no longer charming, those are things that go into their mind, and they feel they are not worthy. And it has a long-term consequences I'm going to show as I discuss what happens in postpartum psychosis or postpartum depression. And how, when the mothers now deliver, how do they show that there could be signs? Sometimes they reject the babies. You try and take the baby to the mother to breastfeed, and the mothers are not keen to even hold the babies. They are not interested in the babies. They do not want to talk to anybody. They feel they just want to be with themselves. They want to be in a closed room, and they just want to be with themselves. They do not want to talk to anybody. They do not even want to eat food. They are disinterested even in the things that they liked most. So when you see a mother behaving like that, let us think about postpartum psychosis, because sometimes postpartum psychosis can be a full psychiatric illness, and it can even lead to things like suicidal tendencies, because they feel that they are really unwanted. They feel even the baby is not wanted, maybe by the father, maybe by the people around, and they feel very, very unwanted even themselves, and they are quite depressed, and it can be a full psychiatric illness. So when we have such symptoms in the mothers that have delivered, it is good to take keen interest and let the mothers go to the doctors. When they go to the doctors, then there is some bit of treatment that is given. There is bit of counseling, there is bit of psychological support. And if the issue is beyond those two, then the psychiatrist can give some medications. We at Savannah, we take that very, very seriously. We have on board a psychologist that we normally, when we do sense such issues, then we have a psychologist who can help us. So it is important for us to understand that postpartum psychosis is real, and when you cite such symptoms that I have described, it is good to assist the mother and get some help for psychological support.